All right, so today we're going to kind of be discussing the different psychological disorders, what a psychological disorder is. We're going to talk about mood disorders, anxiety disorders, and then personality disorders, as well as dissociative disorders. So let's just get started. So, as you know, how you might know, stress is a precursor for psychological disorders. So one thing that's kind of relevant in our society today is that stressors are becoming more and more relevant. And pairing that with our now more sedentary lifestyle is not necessarily a good thing. And when we're talking about psychological disorders, everyone's weird. No one's normal. What really is normal? So just know that psychological disorders are on a continuum, and really everyone is on the continuum. No one's perfectly normal, as you could say. So lately there kind of has been, so nowadays compared to later or earlier, there has been an increase in the rates of diagnosing people. And then just some general stats on that. There are every 13 and a half minutes, someone's going to commit suicide, which is a crazy high number of suicides. Suicides is now the third leading cause of death in the United States of America, which is just incredible. And if you were to look at a graph of death rates right now in America, things like cancer and heart attacks and car crash deaths are going down. Maybe not this dramatic, but they are on a decrease, whereas things like death by drugs and death by suicide are increasing dramatically. So why is it that those two are going separate directions? And one thing to think about is how easy is it to get treatment for other health disorders versus mental health disorders. So if you think about it, if I have an ear infection and I want to solve that ear infection, what am I going to do? I'm going to go to my doctor, I'm going to set up an appointment, I'm going to tell him that my ear hurts, he's going to look at it and say, perfect, here's your prescription, take this medicine, and it's going to be gone away. However, if let's say you're struggling with depression, first of all, you have to go to your general care provider, doctor. You're going to have to call in and schedule an appointment. What are you going to say when you schedule an appointment? You have to tell the person that you are depressed, and then they're going to ask questions like, well, have you ever thoughts of suicide? Have you thought about suicide? All these deeply personal questions that are making you depressed because you're feeling them, you have to tell to a stranger. And then you go to your general doctor who you probably don't know that well, and you got to tell the whole story again. And then what he's going to do is he's going to give you a couple psychologists that he recommends for you to call. And then what you have to do again, you have to make a phone call to set up an appointment and probably leave a voicemail with a psychologist that you don't know about your story. And the point of it is that it's much harder to get help for mental health than it is to get help for other health problems that we're having. So that may be one factor that factors into that graph that we just talked about. And just a general thing is that mental health disorders, they're going to have a huge impact on the life choices that we make, which is why mental health is something that needs to be taken so much more like seriously. So when we're talking about what is normal, I mean, like we said earlier, normal there's not really perfect normal. Everyone's on the spectrum. However, social context is important when discussing abnormalities because things like religions and cultural practices can change how you diagnose individuals because cultures may be doing things differently than what you think the norm is. So those are some things just kind of take into account when discussing diagnosing disorders. So what is a psychological disorder? So a psychological disorder is patterns of thoughts, actions, or behavior. So thoughts, feelings, or actions that are deviant, distressful, and dysfunctional. So let's break down what those 3 Ds are. So the first one is deviant. This means that your actions are going to deviate from the norm or from what's normally expected in society. So like a deviant thought would maybe be one of suicide, for example, or a deviant feeling could be one of emotional distress and emotional distress levels, high stress levels. And then maybe a behavior or an action that could be deviant could be one of suicide even, or maybe even just like hurting yourself or others. Distressful, this is just like personal behaviors, like we talked about, feelings or thoughts that are going to be distressing towards yourself. And then dysfunctional are going to be thoughts, feelings, or actions that are going to impact your daily functioning, whether that be going to your job or just socially being involved with others, friends, eating, sleeping, anything like that. That's how your thoughts and feelings can affect you dysfunctionally. So when you're classifying psychological disorders, the manual that we use is the Diagnostic and Statistic Manual, otherwise known as the DSM. And right now we are on version 5, so we use the DSM version 5. And so you look at the specific criteria, and that's how you kind of go about diagnosing your disorder. So the first one we're going to talk about is mood disorders. So the first one is depressive mood. So can anyone think of a depressive mood? So depressive moods be like everything's feeling really slow, you lack energy, you kind of feel like your whole body's heavy. Maybe you're not taking part in the type of activities that you normally find fun and exciting, things like that. And even sometimes you can feel numb, like you don't even know how you feel, you don't know how to feel, because that's just how the feel of a depressive mood is. So a depressive episode, you have to have at least 5 or more of these symptoms for 2 or more weeks at a time. So depressed mood, anhedonia, which is like we talked about before, like diminished interest and pleasure in things that you normally find pleasurable. Significant weight loss or weight gain, insomnia or hypersomnia, which would be, insomnia is like you can't sleep enough, whereas hypersomnia would be you sleep too much or sleeping throughout the whole entire day. Psychomotor agitation or retardation. So psychomotor agitation would be like if you're sitting at home on the couch and you're just like fidgeting with things, you can't stop, you can't sit still. And then whereas retardation would kind of be like that numb feeling where like you're not even affected by anything, your body just doesn't respond because you don't have the energy to do it. Which leads to the next one, which is fatigue or loss of energy, which is just like you don't feel like you really want to do anything. And then feelings of worthlessness or guilt. And I know that everyone will experience feelings of guilt throughout their life. So for it to be a symptom, it has to be out of proportion and just way over the top. And then concentrating difficulties or indecisiveness, and then also things like reoccurring thoughts of death or suicide. So these symptoms have to be cause distress or impairment in your life, as well as they can't be caused by drugs or medical conditions or medications that you're on. So the next mood disorder that we'll talk about is a manic episode. So a manic episode is basically an elevated or irritated mood for 1 or more weeks, and it's going to be accompanied with persistent goal-derived actions. So if you are experiencing a manic episode, you have to have 3 or more of these next symptoms. Things like inflated self-esteem or grandiosity. And grandiosity just means that you think you're better than everyone else, and that you're always right, and you're perfect, and you're better. Sleep deficit, you don't feel like the need to sleep. Talkativeness, a lot of ideas all over the place, easily distracted. Increased goal-directed behavior, like I'm going to do this, I'm going to do this, I'm going to do this. Psychomotor agitation, which is paired with that, which is like restlessness, fidgeting. And then indiscretion with pleasurable activities, so you can't really discriminate between what's pleasurable and what's not, because it all kind of just feels good right now. And then again, this has cause impairment, and it can be due to drugs or medication or other medical conditions. So when we're talking about diagnosing a depressive disorder, there are three main depressive disorders. There's major depressive disorder, there's persistent depressive disorder, and there is premenstrual dysphoric disorder. So major depressive disorder, so this is an experience of a depressive episode that is very intense for an acute amount of time. So if we were to talk about a major depressive disorder, this would be like if your normal functioning is right here, and then you drop down and you have a depressive episode for 2 or more weeks, and then possibly go back up, and then down, and so it's going to be reoccurring, and it's going to be continually having those 2 or more weeks of depressive disorder episodes. Persistent depressive disorder, so this is like when you're not necessarily in a full depressive episode, but you're not at normal functioning level for extended amount of time. So if this is your normal functioning level, this is your depressive episode, you're about right there in the middle. And this has to be going on for 2 or more years in order to be diagnosed. And then premenstrual dysphoric disorder. So this is like what it sounds like. It's before that, the menstrual cycle for females. And what it is you're at your normal functioning level, and then this is your menstruation. And for about 5 to 10 days, you're going to be experiencing depression. And if you think about it, how often does a menstrual cycle occur? Right, once every month normally. So if you have once every month and you're experiencing it 10 days for every month you're having it, that's 120 days a year that you have depression. That's pretty intense. So the next category that we're kind of going to talk about is bipolar disorder. So there's bipolar 1 and bipolar 2. So bipolar 1 is you possibly are going to have one major depressive disorder and then at least one manic episode. So that'd be bipolar 1, and then bipolar 2 is going to be a low-level manic episode, so maybe not even a week, more like 4 days, and it doesn't necessarily have to impair you from normal life. However, it has to be paired with at least one major depressive disorder. All right, so let's move on to anxiety disorders. So as we know, anxiousness is a scary thing, but however, sometimes being anxious can maybe motivate us to study more for a test and become more prepared for a test because we're so anxious about it that we just keep studying over and over and over again. So there are kind of different symptoms that you can experience. So cognitively, it can be things like distracted, having trouble making decisions, forgetting certain things. Somatically, or like how our body feels. We can feel like our muscles tense up a lot. When you feel anxious, you kind of get that like tenseness. Headaches, GI, and that's your gastrointestinal area, and that'd be like feeling butterflies or feeling nervousness. Sometimes it can affect sleep, your appetite, things like that. And then behavior. Anxiety can cause avoidance and something known as the neurotic paradox. So the neurotic paradox is like when you're doing something that's actually going to make you feel worse. So Professor Sear was talking about how she had a client, and her client had anxiety, and she couldn't stop thinking about ways that her kids were going to die. And she did this because she felt like if she didn't think about all the ways they could die, then she would miss something and they would die because she didn't think of it. So thinking about how her kids could die constantly, obviously that's very harsh on the brain because you're thinking about ways your kids could die, but she felt like she had to do it so that they wouldn't die. So that'd be an example of a neurotic paradox. So let's get into the first kind of category, which is generalized anxiety disorder. So generalized anxiety disorder is excessive anxiety that lasts for at least 6 months or more. So this is going to interrupt functioning, and it's something that you can't stop. It's uncontrollable. So with GAD, you have to experience at least 3 of these symptoms: on edge, fatigued, difficulty concentrating, irritability, muscle tension like we talked about before, and then some type of sleep disturbance. So the next topic we'll talk about is obsessive compulsive disorder. And does anyone have any thoughts on obsessive compulsive disorder right now? Yeah, well, actually, see, that's the main thing with obsessive compulsive disorder, or OCD, that is misdiagnosed in today's time. A lot of time it's misdiagnosed with perfectionism. People like to say, oh, your binder's so neat, or oh, you have your pen stacked neatly, that's so OCD, or you're at home, your desk is clean, that's so OCD, which is just a term that's tossed around that is really harming, and it shouldn't be tossed around like that, because it's not OCD, that's perfectionism. And that's one thing that's misdiagnosed a lot, is perfectionism for OCD. In order for you to have OCD, there has to be a presence of obsessions and compulsions. So obsessions are things like repeated or reoccurring feelings, behaviors, or urges. And then the compulsions are like the repetitive behaviors or mental acts that are happening because of the obsessions that you're having. And these are mostly unwanted, you just can't control them. Another factor that plays into this is that it has to be time consuming. So it has to take up at least an hour a day in order to be categorized as OCD. So in that, for example, an obsession could be like cleanliness or contamination, fear of contamination on the hands. An image that could be obsessive could be a horrific scene, and you just keep reenacting it in your mind, that mental act of compulsion. And then lastly, maybe an urge could be stabbing someone, or an urge of throwing and breaking things. Things like that can be categorized with OCD. 2 other disorders that are kind of under the OCD umbrella would be body dysmorphic disorder, and this is just when you think that there's something wrong with your body. Like if I was to look in the mirror and say, oh, my biceps are too small, when in reality they are a okay size to have. And then another disorder that can be umbrellaed under OCD is the hoarding. So what hoarding is, so the obsession in hoarding would be like the items that you're collecting, and then the compulsion would be like, I can't get rid of these, I have to hold on to them. And the thing is that with hoarding is that they're possessions that to the person hoarding them seem like prized possessions, but to everyone else they are almost like purposeless and pointless to keep. It can be things like keeping magazines, or keeping your trash, or keeping stickers or stuffed animals, and things that you just don't need, but to you just have some type of obsession and compulsion with keeping them. So next we're going to go into personality disorders. So with the one thing to think about with personality disorders is that you can't change your personality. Your personality is what you're born with, and that's just what you have. So that's the tricky thing with coming to personality disorders, is that your personality is your personality. So when talking about personality disorders, there's kind of 3 clusters that we clump people into. Cluster A, B, and C. So cluster A is the odd and eccentric behavior. This is like when people just socially don't act normal in society. A great example of this is like, how many people have seen Willy Wonka? Exactly. And Willy Wonka just doesn't function normally in society. He's just a little bit off, and that's what cluster A is. So for example, like a schizoid personality disorder would be under cluster A, and someone who has schizoid would be just no interest in other people or relationships, fine being alone, and just don't care about anyone else. It's no intention to have any other relationships. So next we have cluster B. So in cluster B, these are individuals that are more dramatic and erotic and impulsive, and then generally they're going to hurt others. So the first one that we'll talk about and discuss is antisocial personality disorder. So in antisocial personality disorder, these type of people are going to be really, they have a disregard for the rights of other people's. They don't really care what other people are going to do. They're going to do what they want, and just that's how it's going to be. They lack empathy for others, and they just don't care how their actions are going to affect other people. Just to talk a little about research, that there was a researcher, and he was looking at the brains of people who were diagnosed with antisocial personality disorder. And he came to the conclusion that the brains of individuals with anti-personality disorder are different than a normal brain that doesn't have antisocial personality disorder. So then he went ahead and scanned his brain just because he was curious, and he found that his brain looked the same as the other individuals that were in his experiment. And so then he started going around and asking his family members if they've seen any of these type of actions in the way that he's been acting his whole life. And surprisingly, all of his wife, his mom, his brother, all agreed that he has had these antisocial personality disorder characteristics in his life and how he goes about his life. And so he dug deeper to say, well, why haven't I acted on my urges? And he came to the conclusion that he didn't have childhood trauma experiences, but every single person who was diagnosed with it did. So that's kind of what he came to the conclusion as whether you're going to act on your urges or not with this. So the next one is narcissistic personality disorder. Narcissistic personality disorder are individuals that lack empathy. They can, some vary in may violate the rights of other individuals, and really the main one is grandiosity. They think that they're better than everyone else. They're always right in everything they do, and they're never wrong. They're just right, and they're better than you. The next one is borderline personality disorder. And borderline personality disorder can be seen as like instability in relationships. This can be like erotic or impulsive behavior in relationships because they're just so scared. They're so fearful for the idea of abandonment and can't imagine and feel like they're going to be abandoned, so they may have this erotic and impulsive behavior and characteristics about them. And then lastly, in cluster 3, these are more of our anxious individuals. So this is where the idea of obsessive compulsive personality disorder comes in, which is like when you have so much anxiety if things aren't in the right order, where you just can't live. And then another one in anxiety, cluster C, would be dependent personality disorder. Dependent personality disorder is basically you 100% depend on someone else. You're so anxious that you're not going to do it right, you're not good enough, that you have to have someone else help you do everything. So 2 more sections left. We have dissociative personality disorder and then schizophrenia spectrum. So first with dissociative personality disorder, for example, like if a husband and wife were in a fight and one of them dissociated from the fight and kind of stopped talking, that's kind of what we're talking about here. So there are 2 general areas for dissociation. There's a depersonalization and then derealization. So depersonalization is an experience of unreality or detachment from yourself. So a lot of the time you hear people say that they had out-of-body experience, kind of like when they're in the operating room, they kind of like feel like they floated up above everyone and they're kind of looking down on the situation. So that's what depersonalization is, and then derealization is an experience of unreality or detachment from like what's going on out here. So like when you hear people say like time was just in slow motion, or that this isn't actually happening, like this isn't true, this can't be true, this isn't happening. So one thing to talk about with depersonalization and derealization is that these only become disorders and diagnosis disorders if they're reoccurring and happening a lot. So next is dissociative identity disorder. And so this is when people dissociate from who their identity is, and there has to be at least 2 or more different personality traits that you're feeling. So when individuals have DID, they go from one personality to another, and so if I had my personality of Zach and I had my personality of Jim, and someone came up to me and said, "Oh, Jim, like, well, do you know who Zach is?" I would have no idea who Zach is. No recollection, no memory of what Zach knew. I know what Jim knows, and that's what it is. So personalities don't go back and forth. You don't bring information from one to the other. So on average, with individuals with DID, you have about 15 personality traits, and that number is going to increase when you have treatment. Does anyone have a reason why that would increase? Yeah, so it's almost like when you go into treatment, you're giving more attention to these different personalities that you have. So it's almost like telling your brain, this is good, I'm getting attention for my personalities, maybe have more. That's just one idea. And then, so back to my reality, if I was Zach and I was right-hand dominant, and then I came into my other personality and I was Jim, I could be left-hand dominant and write perfectly, which is just crazy. Just shows how powerful our brain is, that in different identities that we have, we can use different parts of our brain to do things, which is just mind-boggling how powerful our brain actually is. And then lastly, we have schizophrenia spectrum. So individuals are going to have behaviors and experiences that are not real. So this can be seen as like hallucinations. This can be auditory, like hearing voices, or visual or tactile or olfactory. Basically, these are going to bring a lot of stress into your life, and you can't stop them. It's like, for example, Dr. Sear was working with a client, and they kind of got to the conclusion where she was like, my voices aren't going to leave my head, but I'm going to tell them no, and I'm telling them I'm not going to listen to them, and I'm going to push them to the side, but I'm still going to hear them. So it's like something you can't control. And then again, these are going to be paired with disorganized speech and behavior. So another idea with this is delusions. And so delusions are like fixed beliefs. And even when you provide like a substantial amount of evidence that these beliefs are wrong, you're not going to change their mind. So for example, if I was thinking, oh, the CIA is in my house, and the CIA is tracking me and looking through and has cameras in my house, and then you have a security crew come in and debug your whole house and say there are no bugs in your house. There's no evidence that the CIA, and you're just like, and that evidence doesn't matter to you. It's not going to change it. That's what you want to think. That's what they want you to think, that they're not watching you, but really they are watching you. And this is where we kind of get to the differentiation between a bizarre and a non-bizarre delusion. Whereas a non-bizarre delusion would be like the CIA tracking you, because that could be happening, that could happen. So it's not necessarily bizarre, but a bizarre one would be like, I woke up and I had a whole set of new organs in my body. Because if that happened, you would like be sore, you wouldn't be able to move as well, you'd have cuts on your body and scars and things like that, where that would just be more of a bizarre. And that first one would be more of a preservatory delusion, whereas a grandiose delusion would be like believing that you're actually someone else than you are. And most of the time this is seen in like believing that you're God, you're the second coming. Or there have been examples of individuals who think that their babies are the second coming of Jesus. And so that would be like a grandiose delusion. So that is the end of the personality disorders that we will be covering. Thanks for listening.